Hello Zach Singh, how are you doing? Alright, as you know me already, I'm Dipendra Saki, student RN at Western Sydney University, and this is my second RN who will be taking care of you this evening. So I'm just going to give her handover of your details so that she can carry on with your care. Is that alright? Good. So Zach Singh is a 64-year-old man. He has just returned from his endoscopy and colonoscopy due to his bowel obstruction. He had his blood test and CT scan done as well. The CT scan results are out and shows that there is a mild circumferential wall thickening of the proximal ascending colon and distal ileum, and there is also presence of strictures in his terminal ileum that was the main reason for his total bowel obstruction. So the gastroenterologist recently visited Zach Singh and explained that there is numerous development of large patches of inflamed mucosa and submucosa throughout his small bowel and colon. So he has decided for surgery later today to remove the affected area of ileum and to perform an end-to-end anastomosis of the ileum as well. So informed consent has already been taken from Zach. Is that right, Zach? The informed consent are taken? The consent has been taken already. So Zach is nil by mouth at the moment. As you know, he's having surgery later on. So currently we are administering him metoclopramide IM because he had a large volume of bowel vomiting before, and we are providing Panadin 40 for his pain as well. Currently he has no further vomiting, but he is allergic to paracetamol, which causes him full body rash, so we might have to observe him closely if he shows any signs of reaction to the medication. So Zach Singh had medical history of Crohn's disease that resulted in bowel obstruction at terminal ileum. His abdomen was swollen with tender mass at the right lower quadrant, causing him rebound pain and decreased bowel sound as well. And he has also told that he is anorexic towards losing weight, so he is losing quite a bit of weight. And I've conducted his A to G assessment as well. His airway is clear, as you can see. He can speak without any obstruction. I don't see any issues there. He's little hyperventilating as he has 24 breaths per minute respiratory rate, but the normal range is 10 to 20 breaths per minute, and his oxygen saturation level is also a little low at 95% in normal room air. He's also hypertensive as well, with blood pressure 95/70. He's tachycardiac with 114 beats per minute, where the normal range is between 40 to 100 beats per minute. So I think it is a possible sign of vasodilation since there is low oxygen level. He is also low on nutrients, and there is increase in temperature as well. I've observed with peripheral pulses as well. His skin looks pale. There are some signs of hypothermia as well. He's feeling cold, and his capillary refills are also very poor. He seems quite alert to me. As you can see, he is responding to our questions. I don't see any kind of issues with his alertness, but he has a body temperature of 38.3 degrees Celsius. But this can be because of his pain, as he has mentioned 7 out of 10 pain score before. So maybe you can observe his oxygen saturation, and you can provide some oxygen through nasal prawns to bring his saturation level up. This might probably help to bring his BP higher as well. It might be a good idea to put some warm blankets on as well, as he was showing some signs of hypothermia. Since he's allergic to paracetamol, any signs of allergic reaction need to be closely observed. Any complication, then you just call the doctor immediately. Since no fluid has been provided at the moment, maybe you can call the doctor to check if he wants any IV fluids infusion before the surgery. And the BGL has not been taken as well, so you might want to take BGL later on. That's all the information for the handover. Do you have any issues or questions, Zach Major, at all regarding this? All right, so if you have any uncomfortability or have any question, then just press the buzzer and someone will be here to help you out. Is that all good? Yeah, sure. So that's all the information, and the handover is done. Thank you.